Whether you are a 26-year-old and you got kicked out of mommy and daddy's health insurance plan and you need to find health insurance on your own, or if you're a 40 or 50-year-old in between jobs and you got let go because your previous employer was downsizing and you just need health insurance for just in case reasons while you're in another job hunt, you need to understand what your financial exposure is while you're shopping for your health insurance plan. Your financial exposure is this: deductible plus coinsurance equals total out-of-pocket max. Coinsurance is just another fancy way of saying a second deductible. Okay, coinsurances can be anywhere from 80-20 to 70-30 or 90-10. What this means is that, and 80-20 is really popular among group health insurance plans. What this means is if you find a plan that has a $5,000 deductible, you have to pretty much pay for the first $5,000 worth of medical bills. Then you only pay 20% of the bills, and the insurance pays the other 80%, but you only pay 20% of the bills until you reach your co-insurance max. Okay, and then your total out-of-pocket max equals deductible plus co-insurance. So if you got pre-existing conditions like diabetes and you're on the Obamacare market, instead of healthcare.gov for ACA plans, you can go to Health Sherpa. You just type in your zip code, age, income, and based on income, sometimes you won't get a discount. So the cheapest plan that is a PPO is going to be at least $573. When you just see a $6,200 deductible, that is not the be-all, end-all. There's still an out-of-pocket max of $9,450. If I were to scroll down to like page 9 and consider buying the most expensive plan, it'll be $693 for a 40-year-old, but the deductible will only be $750, which is low. But if I got involved in a bad car accident or a cancer diagnosis and it's like $1 million worth of medical bills, I'm still in the hole for $9,450, not just the $750 deductible. Because remember, $750 deductible is just the first line of exposure. So once you reach your $750 deductible, if you look at the plan details on this, you'll see two different columns: before the deductible is met and after the deductible is met. If I got involved in a terrible car accident and it's $1 million, I'm definitely going to have a procedure. I'm definitely going to stay in the hospital. So I'm going to pay for the first $750 deductible. Then I'll only pay 20% up to the coinsurance max. The coinsurance max in this scenario is going to be $9,450 minus $750 deductible. So if I bust out a calculator here, clear the tape, $9,450 minus $750 deductible equates to $8,700, which is $8,700. So for this particular Obamacare plan, at $693 wonderful dollars a month, I'll have to pay for the first $750 deductible, and then I'll only pay 20% up to $8,700, and then they'll pay 80%. But $750 plus $8,700 equals $9,450 max out of pocket. Now, if I settle for less and I consider an HMO plan, which sucks more than a PPO, HMOs are typically cheaper, and it's going to be like $323. I'm only exposed to a $9,450 max out of pocket if I'm in the network. So it's very important that you always try to stay in the network, because that's the contractual rate that the health insurance company has between the health insurance company and the provider. A provider is either a doctor, a surgeon, a hospital, a lab facility. It's important to be in the network so that you're only subject to this. But if you consider a cheaper plan that's an HMO, and you got in a terrible car accident and it's $1 million, you could be subject to whatever the hospital charges you. You're not going to be subject to just $9,450. You must be in the network. If you're out of network, you could be responsible for the entire $1 million claim. So Whether you're afraid of a car accident or cancer or stroke or, I don't know, just a pickleball sports injury and somebody hits you in the eye socket and the bills for that is going to be like $50K for a new eyeball. This is your financial exposure. Deductible plus coinsurance equals total out-of-pocket max. All right, when you're shopping for non-Obamacare plans, you want to definitely look at the PDFs. Don't just look at the website. Like I'm on eHealth right now, and the plan details are all manually typed in. $10,000 deductible. This is not the legal documentation that discloses what is covered and what is not. This is just all edited online. It'll disclose the deductible, but make sure you click on more details. It'll tell you that the coinsurance is 20%. It won't tell you that the health insurance will pay 80% of the bills. Your out-of-pocket limit is $20,000. So in this scenario, $20,000 is your out-of-pocket. Out-of-pocket limit is also another way of saying out-of-pocket max. And your deductible is a wonderful $10,000. And it's 80-20. How do I know this? Well, it just says 20%. That's your responsibility, and then insurance will pay the other 80%. The coinsurance max is not going to be $8,700. So 20,000 minus 10,000 equals 10,000, which is your coinsurance max. What this means is that once you reach your $10,000 deductible, you pay 20% up to another 10,000, but your out-of-pocket max is going to be 20,000. You want to not just go by what it shows on the website. You want to click on even more plan details somehow. And you click on the brochure. This is the legal documentation that discloses to you what is included and what is excluded. So when you click on this, it's going to take you to this PDF document. Before you buy a health insurance plan, if you feel like you got some stuff going on and you need some type of outpatient surgery, you want to make sure that the procedure that you're trying to get done is not excluded, because you got to read the small fine print on the back of the PDF documents. These are all excluded. All of this is excluded. And then there's waiting periods. Sometimes, even if the effective date is whatever date you select, that doesn't mean that it's going to cover this, or I can't even pronounce that. There is a 3-month waiting period for all of these wonderful procedures.
Now, why are there waiting periods? Because health insurance companies are in it to win it. It does not make business sense for them to receive $500 of your money and then for them to pay out $20, $30, $40, $50,000 worth of medical claims right away. So that's why there's waiting periods. That's why there are exclusions. So make sure you shop around and find out what is not covered. Before you buy a car, you want to test drive it. And before you buy a health insurance plan, you want to make sure that you understand what is not included. You want to make sure your doctors are in the network. You want to make sure that you just want to make sure.
Now, when you're looking at Obamacare plans, because you got pre-existing conditions, you don't just want to go by what it shows on the listing. You want to click on the plan details. So try to avoid HMOs if possible, if you can afford it. If you click off on PPO, the cheapest PPO is going to be $416. Click on plan details. You want to select all of these. Summary benefits, the drug formulary. A drug formulary is where it discloses, the health insurance company discloses which medications are covered from tier 1 to tier 2, 3, and 4. And then the provider list is a website where, yeah. Yeah.
I need to show you something.
Right now? Okay. What happened?
It's in here. It didn't work.
Wow, there's a bone there.
You can't
You can't take it out?
No. Hands are too small.
Your hands are too small?
Uh-huh.
There you go.
Thank you, Dad.
You're welcome.
This is shiny. But Dad,
Where was I? Okay, so the provider list is just a link that discloses where doctors and hospitals are located and if they are accepted and if they're in the network. So when you click on the summary of benefits, this is the legal documentation that tells you the be-all, end-all as far as what is covered and what is not covered. It's very intimidating, but before you buy a car, you want to test drive it, and before you buy a health insurance plan, you want to make sure that what you want to be covered is in fact covered. Look at the exclusion section. If you think acupuncture was going to be covered for this health insurance plan, think again, it's not covered. And this is $400, $416 a month. Abortion is not covered. Cosmetic surgery like implants or anything else is not covered. But these are covered. And then you want to dissect it. You look at the columns where it says participating provider. That's another fancy way of saying in network. Non-participating provider means out of network. It's definitely going to be cheaper if you're in the network versus out of network. So as much as possible, when you want to go see a primary care physician, you only pay $30. There's a defined copay. But if you go see a doctor that is not in the network and they charge you like $300, you're going to pay 50% of that. And so you'd be on the whole of $150. So always try to be in the network. Specialists, they're doctors that are highly specialized and go to medical school longer. So therefore, they charge more than a primary care physician. A specialist is going to charge anywhere from $250, $350 to $400 and up. But with this particular plan, you only pay $40 every time the doctor does this, just talks to you and gives you their consultative advice. Preventative screenings like cholesterol screenings, blood work, depression screenings, whatever, there is no charge. And the specific link to that is this. It's on healthcare.gov for adults. All of these things are free 99. They are free so long as the results don't come out that you have high cholesterol or depression or high blood pressure. It says right here, these services are free only when delivered by a doctor that is in your network. There should be a second sentence here that says, and also if your results are normal, because if they're not normal, you will be paying something out of pocket. Case in point, I had a cholesterol screening done 11 years ago when I was a youthful 29-year-old lad, and I definitely made sure that the lab facility was in the network because I didn't want to pay anything. But then 24 hours later, they told me I had high cholesterol. And so because I had high cholesterol, I had to pay $300 out of my pocket for that visit, and I was pissed off, and which is why I remember to this day that all of these are free, but only if your results are normal and healthy. And if you come out that you got HIV, you're going to be paying for it. You're going to be paying for the labs. So all these things are free for women from number 1 down through 12. Plus another 15. All of these services are free under the Affordable Care Act. This is for only Obamacare plans, not for short-term plans. Okay? So MAMS, PAPS, all that women's stuff is covered for free. So it's important to find out what your financial exposure is, because deductible is just half the battle. You must be in the network. You have to consider the co-insurance. And then there's the total out-of-pocket max, which is what you are in for. And also know the difference between major medical versus fixed benefit plans. Heart attacks in America can range at about 1.6 million according to 2020. A liver transplant could be 878,000. Kidney transplant could be 442,000 if you find a donor. A terrible car accident can be as high as $1 million or more. Not fun. So if you have questions regarding your financial exposure, just DM me or send me an email. Bye! Oh, that's a good way to end it.